So our next topic is one of great importance to prostate cancer recovery. And I'm going to introduce Dr. Daniel Santamina. He's a kinesiologist and researcher with interest in surgical rehabilitation and exercise oncology, with a specific focus on prostate cancer. Dr. Mina is an associate professor at the University of Toronto in the Faculty of Kinesiology and Physical Education, and cross-appointed to the Faculty of Medicine, the Department of Surgery. He is also a clinician investigator in the Department of Anesthesia and Pain Management, and Director of Research and Programming for the Prehabilitation Program at the University Health Network. He recently joined Shoppers Drug Mart as the Director of Healthcare Strategy and Analytics. So Dr. Santamina, please proceed.
Thanks so much, Ken, for having me today. It is a great pleasure to be speaking to this audience on exercise. I'm a scientist in this particular space and happily would be able to do a deep dive into all of the research, but I'm going to try to keep it somewhat high level and talk about it as an ingredient in your overall lifestyle. We've been talking a lot about what you can eat, what would be healthy to eat. Well, although this isn't something you necessarily eat, it absolutely is a critical ingredient for your health and well-being. Here are my disclosures. So with today's talk, I hope that you will learn about exercise and its role in prostate cancer, teach you about the exercise recommendations and guidelines, and give you a really strong understanding of how to exercise. And as important as starting your exercise is keep exercising. Okay, so the evidence is convincing, compelling, and overwhelming when we're talking about exercise for people with cancer. Over many years now, several decades, we've learned that exercise can improve many elements of your health and well-being once you've been diagnosed with cancer. And as we continue to learn more, we understand more precisely about how exercise interacts with cancer and health outcomes. But I think probably before we get started in some of the evidence, I just want to talk about or provide some perspective on the actual terms that we're using. So when we're talking about physical activity is defined as any bodily movement produced by skeletal muscles that results in energy expenditure. A bit of a mouthful, but basically the bottom line is as soon as you move your body, you're performing physical activity. Physical activity can be gardening, it can be housework, it can be the activities that you do during your job on a daily basis. So physical activity really is any kind of movement. Exercise is a specific subset of physical activities. Exercise is that movement or activity that you do with a very specific intention to become fitter or to become healthy. And it's typically done in a planned, structured, and repetitive way. So now this type of activity is something that I'm choosing to do routinely for my overall health. It could be like going for a walk, lifting weights, playing sports, and so on. So there's a bit of a distinction between physical activity and exercise. If we became a little bit more precise, when we routinely try to exercise so that we improve our health, sometimes we refer to that as training. And then there are other types of exercises that might be a little bit more oriented towards improving an element of our bodily function. So perhaps we've had a knee injury or a shoulder injury or a back injury, and our physiotherapist or another healthcare professional tells us to do exercises to help recover that injury. Those types of exercises we might refer to as rehabilitation. So exercise, physical activity, training, and rehab are all closely related. But really what we want to talk about is, at least in today's talk, is this idea of exercise, which is something we want you to do routinely for health benefits. So where is the evidence on exercise across the cancer continuum, from the pre-diagnosis or prevention place all the way to end of life and survival? Well, exercise has a ton of evidence in all of these spaces, and I'm going to talk a little bit about it, and I'll break it down by these phases one by one. So bottom line, a good time to start exercising is anytime, but let's talk about the evidence as it pertains to prevention. So can high physical activity levels reduce the risk of prostate cancer? There have been a number of recent meta-analyses and systematic reviews that have explored the relationship between prostate cancer and exercise. And then we'll lump into this exercise term physical activity that also includes occupational activity or lifestyle activity. One of the more recent studies found that while there's no association between physical activity levels and prostate cancer incidence, when they subdivided the type of cancer or the stage of cancer at the time of diagnosis, they found that those who were most active actually had a lower likelihood of having aggressive prostate cancer. So there's a bit of nuance in this particular data. Now, moving on from prevention to the time after diagnosis, I just want to put together a few thoughts here that you may have considered, or maybe things that I've heard clinicians say. He's so frail, I'm not sure how he will handle this treatment, and if he completes his treatment, I think he'll have a hard time afterwards. Or he's not in great shape, he's very overweight, sedentary, not thriving at all. Surgery is going to be especially tough on him. Or perhaps he's super fit. He'll be sidelined from his activities for a while after surgery, but he stands a great chance of a quick recovery. These are some of the comments that in a health setting we might hear about a particular patient who may be diagnosed recently and having to go on for treatment. Well, who would you prefer to be here? I think the choice is pretty obvious. Being that first person, or that person who's super fit, who may be sidelined for a little bit, but is likely to recover quickly, is the goal for many of us. And in one of my areas of research known as prehabilitation, we often like to use this quote from a recent paper. And it says, major surgery is like running a marathon, and both require training. The idea being that surgery really is a physiological and psychologically taxing event in your life. And just like a marathon, you wouldn't want to go into the operating room without being in pretty good shape, because you want to make sure that you are healthy throughout that challenge and can recover quickly thereafter. But we also know that surgery isn't necessarily the only treatment that one might have for cancer. We also know that some people undergo radiation therapy and some people undergo chemotherapy. And when we look at the literature, what we routinely find is that the fitter you are before you start treatment, the better those treatments go and the better you are after treatment. All of these treatments represent very challenging health experiences. And just like a marathon or just like any other challenging health activity that you might participate in, being as fit as possible for it is important. Unfortunately, we don't necessarily think about that time after a diagnosis and prior to treatment as one that is appropriate for getting ready. We don't have getting fit for surgery on our mind like we have getting fit for sport. So when we ask people with cancer how they prepared for surgery, they may have said, nope, no preparation. I just sat at home and stressed. Or asking another man, a 46-year-old man with cancer, basically there's no preparation. I just had to come and get it done. They waited. And the challenging part about waiting is that fear, anxiety, isolation, frustration, exhaustion, and deterioration of your overall wellness can occur. Whereas preparing might actually change or reverse some of these experiences and give people an opportunity to feel better as they're going into surgery rather than worse. So again, this idea of prehabilitation, I know you've heard of what rehabilitation is, but prehabilitation is the process that occurs between the time of diagnosis and the beginning of treatment that includes assessing the whole body to establish a baseline functional level, identify impairments, and provide targeted interventions to help reduce the incidence and severity of current and future impairments. That's a mouthful. Bottom line is get fit before treatment so you can be healthier during and after treatment. And when we're thinking about prehabilitation, we're trying to do it in as many ways as possible. And we often refer to this as multimodal prehabilitation. And this is aligned to the conversation that we've had today. We've thought about exercise as in trying to train our pelvic floor for urinary incontinence. I'll be talking a little bit more about the specifics of whole body exercise in the balance of my talk. We've heard a great talk from Dr. Loeb about nutrition. We've heard from Dr. Matthew and Dr. Whitman about the importance of managing your mental health. Well, all of these can work together in a way where the sum is greater than the whole is greater than the sum of its parts. Exercise is supported by nutrition. Medical optimization to ensure that your anemia is addressed or other medical concerns can help you be active and perhaps eat a healthy diet. Managing your stress, stopping smoking, sleeping well, all of these things together put you in the best possible position to go into your treatment. All of these things would be similar things that you would want to do before a marathon. So again, preparing in as many ways as possible is critical. And so what do we know from the evidence in prehabilitation? Well, it's actually quite impressive. When you prepare for your surgery, many people actually stay less time in hospital after their surgery. Their complication rates are fewer. They have better physical function before and after surgery. The recovery time is better. They have fewer side effects. It might actually change their treatment candidacy, allowing them to proceed with their surgery. And we know that exercise has tremendous benefits on mental health. So again, when going through such an intense and stressful time like surgery or perhaps radiation or other types of treatments, being fit for it helps you get through it much better. But what happens when you are going through treatment? What happens? How do we integrate exercise in that acute period, either during radiation, during chemo, immediately following surgery? What are some of the benefits of exercise then? At least within prostate cancer, we've seen so much evidence as it pertains to exercise during active surveillance, immediately and sometimes before radical prostatectomy, during radiation, or during hormone therapy. In my lab, we've done a little bit of research to look at the relationship between exercise or physical activity and being on active surveillance. And while being active didn't necessarily change the time to treatment or didn't necessarily cause the cancer to be reduced in a particular way that would change a particular course of care, it did actually contribute to better mental health throughout the course of active surveillance. And that's important because active surveillance can often be a time where people can be quite stressed and thinking about their disease. Exercise empowers people in a way that allows them to feel like they have some element of control over their health versus being passive bystanders in their health outcomes. Now, the body of literature as it pertains to exercise and cancer is massive. So I'm not going to go into any specific studies necessarily. And also, all of this data can be applied to prostate cancer as well. So when we're thinking about exercise and its effects on the side effects of treatment, you name the treatment, it shows that people who are active typically have less pain, less fatigue, they're in better physical and mental health, they have better range of motions about their joints. I can go through this long list, but the bottom line is when you're physically active and when you routinely exercise, you feel better and you can do the things that you want to do more often. We've heard about some of the challenges in prostate cancer treatment, like sexual dysfunction or urinary incontinence. Again, strong body of data to suggest that the more physically active you are, these elements of your health can also be improved. Mental health is another one where exercise probably is one of the strongest treatments to support reductions in anxiety and depression and should be a part of any comprehensive mental health program as well. So exercise is good across the spectrum of health, across the spectrum of health outcomes, but also across the spectrum of treatments for prostate cancer. When we think about perhaps the most critical health outcome, mortality, what do we know about physical activity and survival? Well, indeed, there is evidence to suggest that those people who are most physically active have approximately a 20 to 30% reduction in prostate cancer specific mortality. And the more active you are, the lower your risk of mortality is. So these are very strong data from a very large epidemiologic study that support the idea of exercise being life extending. Now, exercise has become such an important part of health that the World Health Organization, through an initiative called Rehabilitation 2030, has really focused on making sure that across the world, we have emphasized and resourced rehabilitation, broadly speaking, which would include general exercise, for every chronic disease, including cancer. And I had the great privilege of working with esteemed colleagues in this space to look at the role of exercise and cancer. And bottom line, the guidelines are very, very clear. Exercise should be a part of your prostate cancer care. Just as you're managing your disease, perhaps with surgery or hormone therapy or other types of treatment, you really should be thinking about increasing the amount of exercise you do because of all of the benefits that it has. Now, on the top, we have here a paper that I worked on that supports this from all the literature across all the cancers with specific focus on prostate cancer. On the bottom here, I have another paper that we worked on that looks at the effects of exercise for people with bone metastases. And even in people with bone metastases, the evidence is quite clear. Exercise can help support people's overall health and well-being and reduce some of the adverse effects of cancer and its related treatment. So even in scenarios where you think exercise might be more dangerous, as long as it's done appropriately and safely, exercise should be a part of your care. A lot of guidelines have gone around here. I'll probably just jump into the main exercise prescription. And it's very easy for me to summarize this quickly. Aerobic exercise is that type of exercise that you do that gets your heart rate up, gets you breathing a little bit more deeply. Try to do 3 days a week of a minimum of 30 minutes per session at a moderate intensity. So this really could be just going for a brisk walk, or if you feel a little bit more comfortable going for a jog, maybe it's a jog, or maybe it's hiking, or maybe it's cycling, or maybe it's swimming. Whatever it is that gets your heart rate up, gets you sweating a little bit and breathing a little bit deeper in ways that might make it a little bit difficult to have a conversation while you're doing it, i.e. making it of moderate intensity. That's a type of activity that you should be doing on a routine basis. You should also be doing some resistance training. So that usually is lifting weights as shown here in this image, but it could also be using resistance bands or your body weight like sit-ups or push-ups. And doing this twice a week, 30 minutes per sweat session with about 2 to 3 sets per muscle group is a general recommendation. These are pretty simple guidelines. And I think that as much as we can simplify them, then hopefully the more easy it is for people to do them. But exercise definitely is not easy to do. And I certainly saw in the chat some of the sentiments around health behavior change, taking time and taking one step at a time to become more active in a very similar way as changing your diet can be challenging. So, like I said, I've been telling everybody that exercise is extremely important. But what are we supposed to do? And perhaps there are a few people on today's call that are support people for the people who have prostate cancer. So what is he supposed to do? Well, first and foremost, just be as active as you can. 90 minutes or up to 150 minutes would be the guideline targets for physical activity, and that's per week. So again, a few sessions of aerobic exercise and a couple of sessions of resistance training should be a part of your journey. This will help keep you healthy, fit, strong, and alive. Now, exercise is not an easy behavior. I think we all have a general sense of the importance of exercise and perhaps what exercise looks like. But I know that many people on today's call will have different things that hurt when they move in a particular way, or perhaps they become fatigued a little bit more easily. Hormone therapy, chemotherapy, radiation therapy, these things can fatigue you quite significantly. And so you may be thinking, well, exercise is harder than it should be for me. Well, in scenarios where exercise isn't so easy, you might benefit from a qualified exercise professional or a specific cancer exercise program. A clinical exercise physiologist or a kinesiologist or a physiotherapist, these professionals who have additional training in exercise should be able to help you develop an exercise routine that takes into consideration your health as it pertains to cancer or your other injuries or other chronic diseases that you may have. Now, if you're looking for an exercise program specifically for people with cancer, I've put this slide up because we've been working on a project in Canada called Excel. And Excel is a free 12-week group-based exercise program that's typically for people who live in rural communities because it's virtual. So you can sign up for this particular study and participate in these classes where they'll do a baseline assessment to get a sense of how fit you are to make sure that your exercise prescription is appropriate for you. You'll be invited to participate in weekly classes twice a week for 12 weeks. So you'll get your dose of exercise in that you need to support your cancer journey. And it'll be delivered by a qualified exercise professional with a lot of experience in cancer. So I've put up one of the coordinators in Toronto, Daniel Sibley's email address here. I've also put up my colleague's website or email address at the University of Calgary. If you contact either of those two email addresses and ask to participate in Excel, they can enroll you very quickly, with the idea being that hopefully in this 12-week program, we can get you started on an appropriate exercise routine for you and build in behavior change strategies that will allow you to participate in exercise over the long term. Another question I get is, well, what do I do? What kind of exercise should I be doing? And it's actually a very easy answer, but not necessarily an easy one to interpret all the time. But the bottom line is, do what works for you. It would be very easy for me to tell everybody to go for a 30-minute jog 3 times a week. But what if you hate running? Or what if it's cold outside or snowy outside? Or what if your knees hurt too much to be running? Well, the key here is now we need to think of an alternative to running so that you get in your 90 minutes of aerobic exercise per week. So you think about other activities that would get your heart rate up, your breathing a little bit deeper, and a bit of a sweat going. Well, maybe it's cycling, or maybe it's only a brisk walk. Maybe it's not jogging, or maybe it's working in the pool, or maybe it's a dance class. Again, critical to this entire idea of exercise is just doing what you enjoy to do so that you do it again. I'm certain that I can get people to exercise for an hour with me when they're in a gym setting. But 1 hour of exercise once is really not the goal here. We need this to be a behavior that sticks. So think about where you enjoy doing it, the time of day that you enjoy doing exercise or being active, how your body likes to move, and what you like to do, or who you want to work out with, and why you're doing it. Sometimes we hear stories about people exercising because they want to be more active with their grandchildren, or that they want to get back to some of the hobbies they used to do. So all of these things are critical to think about when building your own exercise routine. Working out with a partner is a great idea. Keep you motivated with each other, give yourselves challenges, perhaps distract from each other, or distract from the exercise, I should say. So working out with a partner is a great idea for enjoyment, but it's also great for safety, to make sure that if there was an injury, you have someone there to help you. There are tons of gadgets that people become really excited about that help motivate them to see the bells and whistles go off on their wrist, or little badges or stickers that they get when they complete a particular activity. If you enjoy these, fantastic. Use the tools that you think will help you stick to your exercise program. Now, it doesn't really matter where you exercise. On the left-hand side is a picture of my basement. So I've got my kid area right near where I would exercise at home. Some people have condo gyms where they have a little bit more fancy equipment in their spaces. But bottom line is, if you have a place that works for you, you can exercise there. But also, it doesn't necessarily have to happen in a gym setting, so to speak. Exercise is just simply moving your body routinely with the intention of improving your health, as we started off at the very beginning of our talk. So if you like getting outside and gardening, or if you like tinkering around in the garage or building things, as long as you're working reasonably hard and your heart rate is up and you're getting a bit of a sweat, do it routinely. That's exercise too. So it would be great if we could add all of the benefits of exercise into a pill so that you could take it and not have to do that hard work. And the main ingredients in this pill would be the frequency, or the times per week that you exercise, and how hard you work out, and the duration of time you exercise, and what you're doing. Those would be the active ingredients in an exercise pill. Unfortunately, it doesn't come in a pill, and you actually have to do it. And you have to do it routinely, because that's when the benefits of exercise can be experienced. When we think about exercise within the overall journey of cancer, it's important for prevention. It's important in terms of preparing you for treatment. It's important throughout the course of your treatment. It may have nuanced or very specific strategies around how you apply it or do it. for your rehabilitation after surgery. As Nelly mentioned, in prostate cancer, doing pelvic floor training after surgery is a critical way of recovering your urinary continence. And it has to be something that you need to probably invest in yourself to do on a routine basis. So this idea of self-management, figuring out ways that you can stick to it. So it is a part of your journey. I should say it's never too early or too late to start exercising. I often get the question or comment, well, he hasn't been exercising at all ever. This is really not something he enjoys doing. Could he still really benefit? Absolutely. The evidence is very clear. When you start exercising, even after a diagnosis, the benefits are very impressive. Some exercise is better than none. So don't worry if you can't get to 90 minutes per week right away. Perhaps start with 20 minutes, 2 sessions of 10 minutes to get yourself going. Then maybe over some number of weeks, you can steadily work yourself up to 90 minutes and perhaps up to 150 minutes. And then you'll be meeting the guidelines and realizing many of the benefits that so much evidence has shared, has supported. And your exercise plan must fit you. Again, it's very easy for me to tell people to do a particular activity for a particular amount of time and they'll feel better. If that works for them, fantastic. For very many people, it's actually a conversation about the activities they like to do, how they like to do it, and whom they like to do it with. So it is very personal and it is challenging to stick with an exercise routine over time. So don't necessarily beat yourself up if after a little while you don't necessarily have the motivation you used to. You may just need to think about another exercise activity that you might find more invigorating after you've become accustomed to one. Hopefully that provides a little bit of inspiration to become more active in your day-to-day activities. The evidence is very clear. The benefits are vast. And if you need support, feel free to email me or participate in our Excel study. That Excel study is a great way to get started on a cancer-specific exercise program with qualified professionals that are able to tailor the exercise program to you. And hopefully you found that useful and informational, and I'll leave it there. Thanks.
Thank you very much, Daniel. That was an excellent presentation. I can tell you from personal experience that I was an exercise program before I had my treatment, and yes, the recovery is really fast. So I can really vouch for that. See if there are any questions. I don't see any questions in there.
Hopefully everybody is up, moving now, and started
Yeah.
stepping,
Yeah.
moving around.
Yeah, people are really positive about your presentation and the value of exercise. We always get questions about that within the Walnut Foundation, within our support groups. So we do encourage people to take part in exercise programs. So people are asking for your contact information, which is on the screen. There's a question here. Should you do cardio before weights?
It's a great question. Ultimately, it comes down to preference. Some people prefer to do the cardio before the weight. Some prefer to do weights before cardio. There's really not a lot of evidence to describe, at least within the space of cancer, that doing cardio before weights has any benefit in cancer-specific outcomes. Some people, I would only say that it depends on sometimes the type of weights that you're lifting. If you're going to be doing a lot of leg exercises and then you spend quite a bit of time doing leg aerobic training, then you may find that your legs are not quite as strong or don't quite have as much energy in them to do some of the heavy lifting. And in a similar way, if you're doing a lot of arm aerobic exercises, like swimming might be not the best example, but if you were swimming a lot, you might not necessarily find that your arms have all that much strength left to do a heavy resistance training session. So I would say that if you prefer to do one or the other before the other, that's no problem. It would come to a very specific and precise type of exercise prescription where you'd be thinking about, okay, what should I be doing first? But in general, it's not really a big deal.
Okay. Can people without cancer gain from the Excel system?
Unfortunately, the Excel program is specific to people with cancer so that we ensure that the resources associated with that particular project go to these particular folks. However, there are probably a number of other exercise programs that are community-based that you might be able to sign up for. But those are simply not necessarily a part of the Excel project. Unfortunately, the Excel project is only a part of, is only for cancer. But I will say that, you know, for somebody who's participating in Excel, perhaps that participant can help share what they've learned and maybe create another exerciser in the family. So
Is working
hopefully
with
the Excel experience will wear off on others in the household.
right. Is working with a Bowflex machine considered resistance training?
Yes, a Bowflex is it would be considered a resistance training machine. Like other cable or other tension-based devices, the Bowflex would be utilized to build muscle mass and
Mm,
strength.
yeah.
I did see a comment in there that I'll speak to really quickly. It's a
Yeah.
really good one as it pertains to fatigue. And the comment was somewhat related to this idea of, you know, fatigue being a bit of an oxymoron. I think it was the comment that was made saying
Yeah.
that, hey,
More nice.
um, exercise very often can make people feel more fatigued, which is true. However, the less you do, the less you're able to do. And in terms of exercise as its impact on fatigue, it's one of the most effective ways of reducing your overall fatigue. Because when you stop exercising, what happens is you become less fit, and then doing the things that you have on a daily basis become more challenging. And then because you have to do those things, they take up more and more of your energy. And then you go through this vicious cycle of becoming less fit, doing less, becoming more deconditioned, and then becoming more tired because you're more deconditioned, and then doing less. And this circle or spiral downwards in fatigue becomes quite problematic. In fact, what we find is that when people who are quite fatigued, asking them to do a bit of exercise can actually make them feel more invigorated. It recovers their deconditioned state into a conditioned state, gives them more energy to do the activities they have on a daily basis, and thus leaves them feeling less fatigued. So exercise is actually one of the more important therapies for fatigue management, despite the fact that you might think exercise tends to make you tired.
Yeah. It's good. Is it true that folks with prostate cancer should not ride bicycles?
We've done some very specific research on prostate cancer and bicycle riding, and perhaps the risk of increased PSA values in after a bicycle ride. There is sporadic data on this. When we looked at all of the evidence as a whole on those who have done either acute bouts of cycling or long, extended, many kilometer types of bicycle riding, we've looked at mountain biking versus um, uh, tr- um, uh, pavement riding. There really is no relationship between cycling and prostate cancer specific health. You would not necessarily want to do a cycle after particular types of treatment because you have some healing that may be required to occur first. But cycling itself does not increase the risk of prostate cancer, does not change PSA values, and does not necessarily offer any detrimental outcomes to health. In fact, rather, it's a fantastic mode of exercise that keeps people fit.
Great. Next one. I've developed hernia after prostate surgery and now waiting to get consultation from a surgeon on hernia. In the meantime, what exercises should I avoid?
You're going to want to avoid exercises where you are squeezing through the tummy region and bearing down and putting intra-abdominal pressure into your belly region. So you're one of the key things you have to do when you're even not necessarily just exercise specific, but rather when you're lifting things up is making sure that you breathe. Holding your breath can increase your intra-abdominal pressure and put additional strain on the ligaments that are already stretched in that particular area. So make sure that you're breathing consistently whenever you're lifting or bending or turning or twisting. Heavy lifting from the ground up, sit-ups, twisting and turning, those types of exercise that turn you or move you or work you through the midsection are probably ones that you're going to have to be particularly cautious with. But machines that isolate a part of your body like your arms or your legs, as long as you're breathing comfortably, should be okay.
Great. Just one last question. Given metastatic prostate to bone, what specific forms of exercise are best suited for bone or MSK health? what types of exercises should ideally be avoided?
Okay, so when it comes to metastatic bone disease or where there is cancer in the bone, sometimes it can make the bone more brittle and frail and more susceptible to a fracture. And we have to be very, very careful about that because a fracture can contribute to a number of other very bad health outcomes. But just because you have metastatic bone disease doesn't necessarily mean that you should not exercise. The critical advice from the guidelines that we produced about 2 years ago is that if you do have metastatic bone disease, it's worthwhile consulting with your physician and a healthcare professional with specific training and exercise to make sure that you can train in that region safely. So the idea being that we want to make sure that we're avoiding the risk of falls, so balance will be important. We want to make sure that we're not using more weight than we should be using for that particular bone, especially if it's particularly frail. Having good posture and making sure that we are not loading a bone in a way that makes it vulnerable to a break is critical. But all of these things are probably best supported by an exercise professional with some experience in metastatic bone disease. Body weight exercises are a great way to maintain your bone health. Making sure that you are well balanced and positioned will help you reduce a fall. And I think those are probably some of the, at least the basic considerations that I'd be able to offer now.
Okay, thank you very much. We do appreciate this, Daniel. It's been amazing presentation. All
You're
about
very welcome. Thank you for having me.
yes, thank you.